I've been practicing medicine for over 4 decades now, and there's one complaint I hear more often than almost anything else from people over 50. They sit across from me, look slightly concerned, sometimes a bit embarrassed, and they say, "Doctor, I wake up 2, 3, sometimes 4 times a night to use the bathroom." At first, they brush it off. They tell themselves it's just part of getting older, but over time it wears them down. Their sleep becomes lighter. Their energy fades, and slowly, their overall health begins to shift in ways they didn't expect. Now, when I hear this, I don't rush to reassure them right away. Because while it's common, it's not something I ignore. Frequent nighttime urination, what we call nocturia, often has deeper roots. And over the years, I've learned that the body rarely sends signals without a reason. The challenge is, most people never stop to ask what that reason might be. They adapt. They normalize it. And that's where problems quietly begin. Before we go further, I want to be very clear about something. What I'm sharing with you comes from decades of clinical experience, but it's still a general perspective. It's not personal medical advice. Every individual situation is different. If something you hear today resonates with you, I strongly encourage you to discuss it with your own healthcare provider. That's where real, personalized care begins. If you find this kind of discussion helpful, you might consider staying with me until the end. Not because I have something dramatic to reveal, but because understanding these patterns early can make a meaningful difference later on. Now, let's take a closer look at what might really be happening. Many people describe the same pattern. They fall asleep just fine. But a few hours later, they wake up with a strong urge to urinate. Then again, and sometimes again. The next day, they feel foggy, slightly off balance, irritable even. And this cycle repeats. What concerns me isn't just the inconvenience, it's what repeated sleep disruption does over time to the brain, to the heart, to metabolism. And this is where most people get it wrong. They treat the symptom but ignore the cause. The most common assumption I hear is simple. It's just aging. But aging itself doesn't directly cause this pattern. It changes the body, yes. Hormones shift. Organs become less efficient. But those changes create conditions. They don't dictate outcomes. So, when someone wakes up 3 times a night, I don't say that's normal. I ask, what is driving it? Let me walk you through 7 factors I see again and again. First, bladder overactivity. As we age, the bladder can become more sensitive. It contracts more easily, even when it's not full. This creates that sudden urgency. And here's something few people realize. Even small amounts of irritation, like caffeine, alcohol, or artificial sweeteners, can amplify this response dramatically, especially in the evening. Second, fluid timing. It's not just how much you drink, but when. Many people stay busy all day, drink very little, and then consume most of their fluids in the evening. The body doesn't forget that. It processes it overnight. And the kidneys, they simply do their job. Third, prostate enlargement in men. The prostate slowly grows with age, and it can press against the urethra. This makes it harder to fully empty the bladder. So, even after urinating, some fluid remains, and that creates the need to go again, often within an hour. Fourth, hormonal changes. There's a hormone called ADH, antidiuretic hormone, that helps the body reduce urine production at night. In some people, especially after 50, its levels drop, which means the kidneys keep producing urine, even when you're asleep. Now, here's something most people don't realize. Waking up at night to urinate is not always caused by the bladder. Sometimes it's the other way around. You wake up for another reason, and then, decide to use the bathroom. Over time, the brain links the two together. Fifth, sleep disorders, especially sleep apnea. I've seen many patients who believed they had a urinary problem, when in reality, their sleep was being disrupted by breathing interruptions. Each time they partially wake up, they become aware of their bladder. Treat the sleep issue, and the nighttime urination often improves. Sixth, medications. Certain drugs, especially diuretics or blood pressure medications, can increase urine production, and timing matters. Taking them later in the day can shift their effect directly into nighttime hours. Seventh, blood sugar imbalance. Elevated glucose levels can pull more fluid into the urine. In early or poorly controlled type 2 diabetes, this can show up first as increased nighttime urination before other symptoms become obvious. But there are deeper layers to consider. Subtle ones. Circulation changes, for example. When you lie down, fluid that has accumulated in your legs during the day returns to the bloodstream. The kidneys filter it. And you produce more urine. It's quiet, gradual, easy to miss. And then there's habit conditioning. If you've been waking up at the same time each night for months or years, your brain begins to expect it. The pattern becomes reinforced. Even if the original cause has resolved, the cycle can continue. So when you look at this as a whole, it's rarely just one issue. It's a combination, a layering of small factors that, together, disrupt a fundamental system, your sleep. And once sleep is compromised, everything else follows: energy, memory, mood, even immune function. Now, what can you actually do about it? Start with awareness. Pay attention to when you drink fluids. Gradually shift more intake earlier in the day. Limit stimulants in the evening. Observe patterns rather than reacting to them. Next, review your medications with a professional. Timing adjustments alone can sometimes make a significant difference. If symptoms persist, consider evaluating sleep quality. Not just how long you sleep, but how stable it is. Conditions like sleep apnea often go undiagnosed for years. And, perhaps most importantly, don't dismiss the signal. Your body is not trying to inconvenience you. It's trying to communicate. Quietly, yes, but consistently. I've seen many patients improve, not through drastic interventions, but through small, thoughtful adjustments made early enough. If this topic resonates with you, or reminds you of someone you care about, it may be worth paying closer attention tonight. Not with worry, but with curiosity. Because sometimes the smallest disruptions are the earliest indicators. And noticing them, that's where real prevention begins.